Welcome back to Anatomiqa. To recap, the development of bone, we discussed types of ossification, various stages of membranous and endochondral ossification, loss of ossification, effect of X-rays on bone, and factors affecting bone growth. In this session, I will be discussing on various aspects of clinical anatomy of bone. Let us discuss clinical anatomy of bone one by one. Developmental anomalies are called congenital anomalies because the defects are present by birth. Gross anatomy defects are the injuries on physical body, and genetic is any defect at the structural level leading to birth defects. Let us start with developmental anomalies. Cleidocranial dysostosis is a clinical condition caused by defective intramembranous ossification. It is a congenital anomaly. The bones like skull vault and clavicle developing from intramembranous ossification will be affected and will be defective. It is characterized by three cardinal features: varying degrees of aplasia of the clavicles, that is partial or complete absence of clavicles. Due to the absence of clavicles, affected individual can bring both the shoulders close together. In the fetal skull, there will be retardation or delay in ossification of the fontanellae, causing large fontanelles and delayed closure of sutures, due to which there is increase in the transverse diameter of cranium. It may be hereditary or environmental in origin. Achondroplasia, one of the commonly known congenital anomalies of the skeletal system, is caused by defect in endochondral ossification of the epiphyseal plates of long bones. The child has disproportionately shorter limbs than trunk, which is called as dwarfism. Proportional large head, short curved arms and legs, dorsal lordosis, that is convex curvature of vertebral column, and short fingers and toes. The mental development is normal. This condition is inherited as an autosomal dominant trait due to mutation of fibroblast growth factor receptor 3 gene. That is the X-ray of the person with achondroplasia. Anomalies of bone formation. Dyschondroplasias or enchondromatosis involves excessive proliferation of cartilages at growth plates in the long bones. These cartilages form abnormal cartilage masses with the metaphysis. In rickets, calcification of cartilage fails and ossification of the growth zone is disturbed. Rickets affects the growing bones and therefore the disease develops during the period of most rapid growth of skeleton, that is 3 months to 3 years. Osteoid tissue is formed normally and the cartilage cells proliferate freely, but mineralization does not take place. Rickets is the children's form of osteomalacia. Signs include bowed legs, deformities of the pelvis, ribs and skull. This results in craniotabes, which is the softening of skull bones, rachitic rosary, where there will be knob-like or bead-like appearance at the costochondral junctions, Harrison sulcus, a funnel-like groove, which is indentation on chest along 6th and 7th ribs at the diaphragmatic attachments, enlarged epiphysis in limb bones, and the spinal and pelvic deformities. For proper development of bones, a child requires adequate amounts of proteins, calcium, vitamin D. Deficiency of calcium and vitamin D in growing children leads to widening of ends of bones with inadequate ossification. Periosteum is particularly sensitive to tearing or tension. Drilling into the compact bone without anesthesia causes only mild pain or an aching sensation. Drilling into spongy bone is much more painful. Fractures, tumors and infections of the bone are very painful as the periosteum is richly supplied by somatic nerves. In scurvy, due to deficiency of vitamin C, formation of collagen fibers and matrix is impaired. Defective formation of the intercellular cementing substances or ground substance and lack of collagen cause rupture of capillaries. This leads to hematoma in the muscles and bones, causing severe pain and tenderness. Without blood supply in the bones, normal architecture at the growing ends is lost. The causes can be genetic factors or a combination of genetic, hormonal, and nutritional factors. Symptoms are weaknesses, anemia, gum disease, and skin problems. The defects in vertebral arch or laminae of the vertebral column may lead to the exposure of the spinal cord and may be covered just by skin. This is called spina bifida occulta. If there is protrusion of only the meninges surrounding the spinal cord placed in the vertebral canal, it is called meningocele. If there is protrusion of the meninges as well as spinal cord, it is called meningomyelocele. Deficiency of calcium in bones in old age leads to osteoporosis, seen both in males and females. Osteoporosis refers to reduction in the quality of bone by loss of both bone mineral and protein content, resulting in porous bone. Due to osteoporosis, there is forward bending of vertebral column leading to kyphosis. In elderly people, the bone matrix contains proportionately less collagen fibers than the inorganic salts compared to bones in young people. As a result, they become brittle. In addition, elderly people have less dense bone matrix because of osteoporosis. Due to a combination of reduced density of matrix and brittleness, their bones break more easily. If deficiency of calcium occurs in adult life, it leads to osteomalacia. Causes for deficiency of calcium can include insufficient dietary calcium, insufficient vitamin D fortification, or insufficient exposure to sunlight. The bones on X-rays examination reveal thick uncalcified osteoid. Osteomalacia literally means soft bones. Coming to the differences between osteoporosis and osteomalacia. In osteoporosis, there is reduction of bone mineral density, and in osteomalacia, it is demineralization of bone where deposition of calcium does not occur during development. The calcium and phosphate is normal in osteoporosis but is low or absent in osteomalacia. Alkaline phosphatase and osteoblasts are normal in osteoporosis but increased in osteomalacia. Trabeculae is thin and small in osteoporosis but thick and uncalcified osteoid in osteomalacia. Osteoporosis occurs in adults over 60 years, but osteomalacia occurs by birth or in children or in adults. The signs and symptoms in osteoporosis are kyphosis, that is curving of back, and risk of fractures. In osteomalacia, it is weakness of muscles and fragile bones. Calcium deficiency in pregnant ladies can lead to pliable bones, consequently leading to bending of bone under the weight of the body. During pregnancy, the body has an unusual need of calcium when growth of the fetus requires large amount of calcium. It can be removed from mother's bones, which consequently become soft and weak, leading to osteomalacia. For this reason, pregnant ladies are advised to consume good quantity of milk. Failure of ossification in the sesamoid bone is mistaken for fracture of bone in the X-rays. Example, here you can see the patella. Axis or second cervical vertebra may get fractured. Dents of axis may get separated from the body, as in hanging. It hits the vital centers in the medulla oblongata, causing instantaneous death. Even fracture of laminae also may cause death. Nerves are closely related to bones in some areas. Fracture of bones of those areas may lead to injury to the nerve, leading to paralysis of muscles supplied, including the sensory loss. For example, If the humerus is fractured at the neck, it leads to injury to axillary nerve, which is closely associated to the neck of the humerus, leading to paralysis of muscles and loss of sensation in the skin, which are supplied by axillary nerve. The fracture of long bone in a young person still in growing phase may displace an epiphyseal plate or cartilage. If this is not treated or treated improperly, the longitudinal growth of bone may be arrested or retarded, which results in permanent shortening of limb. There is, coming to the fractures, different types of fractures. There is a separate session on fractures which discusses on types of fractures and the steps of healing. Please refer to the session Bone Fracture and Healing. If infection reaches the intracapsular metaphysis from other areas, it may result in septic arthritis. The articular cartilage may be damaged, and if the infection is not controlled, cartilage may be completely destroyed and subcortical bone may be eroded. Metaphysis is the common site for osteomyelitis in children. It is the zone of active proliferation and has rich blood supply. The metaphyseal arteries in children before epiphyseal union form hairpin bends. The bacteria or infective emboli get trapped in these hairpin bends and causes osteomyelitis, which is inflammation of the marrow and the adjacent bone tissue. Bone marrow biopsy. Bone marrow is evaluated for hematological diseases. The preferred site for collecting bone marrow will be subcutaneous sites like either from manubrium sterni through a process called sternal puncture or from iliac crest in various clinical conditions. In sternal puncture, wide bore needle is inserted through the sternum to aspirate bone marrow, and the same procedure will be done to aspirate the bone marrow from the iliac crest. Bone tumor. Benign or malignant tumors can occur in the bone. They are called osteoma or osteosarcoma respectively. Tumors of cartilage, similar to that of bone, the tumor may be benign or malignant. These are called chondromas and chondrosarcoma respectively. Rupture of the cartilage. The medial meniscus of the knee joint is mostly affected. It is treated by replacement. Bone can repair itself more rapidly than cartilage because of the rich blood supply. The age of people who are still growing can be determined approximately by examining the radiographs of their bones. In X-rays, the epiphyseal plates appear as black lines since there are no phosphate crystals in the matrix of cartilage between the white epiphyseal and diaphyseal areas. So, it is important to know the age of the appearance of secondary ossification centers and the age of completion of ossification or fusion of diaphysis and epiphysis. Coming to the medico-legal and anthropological aspects, when a skeleton or isolated bones are received for medico-legal examination, one should be able to determine the following: whether the bones are human or not, whether they belong to one or more persons, the age of the individual, the sex, the stature, the time and cause of death, estimation of skeletal age. Up to the age of 25 years, the skeletal age can be estimated to within 1 or 2 years of correct age by the state of dentition and ossification, provided the whole skeleton is available. From 25 years onwards, the skeletal age can be estimated to within plus or minus 5 years of the correct age by the state of cranial sutures and of the bony surfaces of symphysis pubis. In general, there is difference in appearance of secondary centers and fusion of the epiphysis in males and females. In females, it occurs about 1 or 2 years earlier than in males. Estimation of sex. Gender can be determined after the age of puberty. Gender differences are best marked in the pelvis and skull, and accurate determination of gender can be done in over 90% of cases with either pelvis or skull alone. However, gender sexual dimorphism has been worked out in a number of other bones like sternum, atlas, and most of the limb bones. Estimation of stature or height in anthropometry is a method used to estimate a person's height using various physical measurements of their body. It is a useful tool in forensic science, archaeology, and medical fields where it is necessary to determine the height of an individual when only skeletal remains or incomplete body parts are available. To estimate the stature, various measurements are taken on the body, including the length of the head, arms, legs, and other body parts. These measurements are then compared to population data to estimate the person's height. One common method used to estimate stature is the long bone regression method. This method involves measuring the length of long bones such as the femur, tibia, and humerus. These measurements are then plugged into an equation that predicts the person's height based on the average length of these bones in a population. Other methods for estimating stature may involve measuring the length of the foot, hand, and other body parts, or a combination of various measurements. It is important to note that while these methods can provide a good estimation of a person's height, they are not always accurate, and other factors such as nutrition, genetics, and health can affect a person's height. Now, coming to genetic factors, thrombocytopenia absent radius syndrome is a rare genetic disorder that affects the development of bones in the forearms and the production of platelets, which are blood cells that help in clotting. It is inherited in an autosomal recessive manner, which means a child must inherit two copies of the abnormal gene, one from each parent, to develop the condition. The main features of TAR syndrome include a missing or shortened radius bone in the forearm, which can cause limited mobility of the affected arm, and low platelet count, which can lead to bleeding and bruising. Other associated features may include heart defects, kidney abnormalities, and other skeletal abnormalities. Diagnosis of TAR syndrome may involve a physical examination, imaging studies, blood tests, and genetic testing to confirm the diagnosis. Treatment for TAR syndrome typically involves supportive measures such as platelet transfusions to prevent bleeding, orthopedic surgery to correct limb abnormalities, and other interventions to manage associated medical conditions. Regular monitoring and follow-up care are important to manage potential complications and ensure the best possible outcomes for individuals with TAR syndrome. Osteogenesis imperfecta is a rare genetic disorder characterized by fragile bones that are prone to fracture, as well as other symptoms affecting various parts of the body. It is also known as brittle bone disease. Osteogenesis imperfecta is caused by mutations in genes responsible for producing collagen, which is a protein that provides strength and structure to bones, among other tissues. The severity of osteogenesis imperfecta varies widely depending on the specific gene mutation and its effects on collagen production. Symptoms of osteogenesis imperfecta can include multiple bone fractures, short stature, hearing loss, dental problems, loose joints, and blue sclera, that is, the white part of the eye appears bluish. There is no cure for osteogenesis imperfecta, but treatment can help manage symptoms and prevent complications. This may include medication to increase bone density, physical therapy to improve strength and mobility, and surgery to correct skeletal abnormalities. Individuals with osteogenesis imperfecta may also benefit from specialized equipment such as braces or wheelchairs to help them move safely and comfortably. Gigantism, childhood hypersecretion of growth hormone by the pituitary gland, causes excessive growth of the individual. Acromegaly, the adulthood hypersecretion of growth hormone, causes overgrowth of bony areas which are still responsive to growth hormone, such as the bones of the face, feet, and hands. Pituitary dwarfism. In pituitary dwarfism, growth hormone deficiency in children results in extremely short long bones and maximum stature of 4 feet. So with this, we are completing the clinical anatomy of bone. In the next session, I will be summarizing all the sessions of the bone.